And welcome. My name is Daniel Rasmussen, and I'm the founder of Pinnacle Integrative Health and the Echelon Center for Longevity. I'm nationally board certified diplomate of Oriental medicine and an integrative and functional medicine specialist. But more importantly, I'm someone who believes that you deserve more than just managing pain until it's bad enough for surgery. A little disclaimer, this information is intended for educational purposes only, not intended to diagnose, treat, or cure any condition, illness, or disease. All decisions to participate in a consultation and or receive any type of medical treatment are between the patient and his or her healthcare provider after discussing all benefits and risks of any treatment. Okay, let me guess. You've been told it's just arthritis. Try some non-steroidal anti-inflammatory drugs. Let's maybe do a cortisone shot if that doesn't work. Or the worst, we'll just replace the joint when it gets bad enough. In the meantime, you're just gonna have to suffer. Does that sound familiar? This is the conventional approach. And this is the reason why you're still in pain. This reactive system was never built to heal you. It's built to manage symptoms using drugs, injections, and eventually surgery. And after things get worse, then the ultimate is obviously the most invasive. Here we see there is clear evidence for steroid shots causing more harm, doing more harm than good. This was a May 2016 study showed steroids increase cartilage loss in knee arthritis. Then we've got some other studies that are clearly indicating, the summary of this study. In summary, the intra-articular corticosteroid injections degenerate articular cartilage in osteoarthritis. Studies have shown no long-term benefit in joint osteoarthritis, and substantial scientific evidence has been offered to the contrary, that the long-term sequelae of injections of corticosteroids into degenerated joints accelerates the arthritic process. So this is not good. There's a whole list here of the common known effects of intra-articular corticosteroids on articular cartilage, where it's just accelerating the degeneration. Potential complications with cortisone injections, tendon weakening, tendon rupture, thinning of the surrounding bone, thinning of soft tissues around the injection site, blood sugar spikes. Insulin, if anybody is diabetic, they know that they're not allowed, they don't give you cortisone injections because it could fuel your insulin resistance. So insulin dysregulation. So all these things are just not, short-term benefit is maybe it's going to help with pain, and the long-term is going to make your health worse. So then you end up with the end stage, the option where you've run out of options. Shoulder surgery. The statistics are that you're gonna go through 12 to 16 months of recovery and rehab time. There's no guarantee of results. There's about a 50-50 satisfaction rate, and out-of-pocket average for a patient, even with co-insurance in the U.S., is around $15,000 to $20,000 per surgery, out-of-pocket patient cost. Knee surgery, again, only about a 50% satisfaction rate. 5 out of 10 are not satisfied. They're sometimes in more pain. And, once the average cost for knee replacement for one knee, total knee replacement is around 10 to 20,000. And not only is this a high cost out of pocket, there's downtime, there's loss of function and recovery from the pain and the suffering. And once it's done, there's no going back. So our philosophy is go the least invasive treatments and go upstream from surgery. Don't wait until things are worse where you run out of options. How about spinal surgery? Statistics of spinal surgery done by the Spine Research Foundation. The spinal procedure with a price tag averaging $80,000 has a success rate of about 35%. And those most likely to benefit are the young, trim, and athletic, not the typical surgery candidates whose average age was 54. Highly recommend if you're struggling with spinal or back pain that you look up this book, Crooked, Outwitting the Back Pain Industry and Getting on the Road to Recovery by Catherine Jacobson Raman. Great book there, a lot of really good information. So, FDA, Medicare, and insurance, what they cover, you basically, with insurance, you get 4 options: pain medications, cortisone or steroid injections, physical therapy, and then surgery. And that's it. No prevention, no regeneration, no real healing takes place. So at Pinnacle, we do things vastly different. We combine modern science with holistic wisdom to treat the root causes, not just the symptoms. So we've helped more than 10,000 patients since our founding in 2010, and we have maintained an 87.5% success rate. This is vastly better outcomes than the 50% success rate of surgery, 30% success rate in spinal surgery. Since 2010, our clinic has been award-winning and recognized, voted top integrative medicine in Washington State. We've been recognized in many publications, USA Today. We've been featured on New Day, on King 5, CEO, Official Magazine, MSN, recognized for our leadership in the regenerative medicine innovation. We've spent over 15 years refining our proprietary method that just works. It's called the GPF method. It's the only non-surgical multi-phase protocol designed to help you become pain-free and active again. So this is our flow process. It's very advanced, high-level care. It's unlike any regenerative medicine. Any other clinics that I know of are not up to speed with this. Your first step is your exam day. And then if you are a candidate, we will map out your personalized program. So this is highly customized and personalized to each individual, but the general framework here, the first visit is we're going to remove inflammation with the alpha-2 macroglobulin injections taken, which inhibits proteases, which are responsible for the softening of your joint tissues. We have to clean those proteases out of your joint. The second visit, that first visit also starts with blood and lymph circulation on the flow presso and peptides. And the second visit is where we start going into platelet-rich plasma, healing the structures around the outside of the joint, tendons, ligaments, nerves, muscles that are all inflamed, typically with arthritis and degenerative conditions. The third visit is rebalancing with activated oxygen prolozone therapy, which accelerates the healing process. Each visit, again, is accompanied by the blood and lymphatic circulation session on the flow presso. We'll go to that in a moment, I promise. The fourth visit, so all these first 3 visits are all about preparing your tissues for the phase 2, which is repair the tissue. So this is visit 4. That's when repair phase starts. We do structural support, cushioning, and signaling of that tissue using Wharton's jelly, which is a cellular tissue matrix, medicinal signaling cells in the Wharton's jelly. We'll go into more depth of that. Blood and lymph circulation on that visit as well. And then the next several months, over the next year, you're going to be in this healing mode where you're going to be doing physical therapy for several weeks. We'll let you know when that PT it's time to start. You don't start it right away. You got to let this healing take place to the point where the inflammation's down and the regeneration is taking place, and your pain level and your function are improving dramatically And then we do a 3-month follow-up with you and a 6-month follow-up on the way to the GPF method 1-year goal, which is to restore function, improve your quality of life, get pain-free, and to surprise and delight our customers and clients. The conditions that we've successfully treated over the last more than 10 years and 10,000 cases. The list here is just a brief view. Probably the most common, of course, are knee joints, which break down the most commonly. Second would be shoulders. Third is lower back, but everything in between. Anything that where you have potential tendon, ligament issues, tendonitis, arthritis, ligament injuries, neck pain, all joints, osteoarthritis of the hands, you name it, we've treated it. These injection procedures work well. If you've got inflammation stuck in the joint, it knocks out the inflammation and repairs and rebuilds that damaged, degenerated tissue. So the prepare phase, let's go into more detail. So this is phase 1 is the composed of 5 steps. Step 1, we've got to get your body's systemic signaling going. We use peptides for this. So at Pinnacle Integrative Health, our ecosystem is the Pinnacle Peptide Lab, PPL. This is your entry point for cutting-edge regenerative medicine. It houses our proprietary peptide protocol, a strategic and highly personalized system for cellular restoration. Peptides are more than just buzzwords. They are your body's precision messengers. These small but powerful molecules signal your cells when to heal, how to clean out dysfunction, and how to generate sustainable energy. This stack primes your biology to respond faster to the regenerative treatments that are coming down the road. No other clinic that we know of is using this proprietary delivery system. Next, on that first visit, also part of prepare phase is step 1, resolving joint tissue inflammation with alpha-2 macroglobulin. This golden X-colored protein is the A2M protein molecule, and the little green Pac-Man looking things are the proteases inside that are softening and wearing away your cartilage. So what we do is we take your blood, we draw it, we spin it, we filter it, highly processed filtering kit. We inject that inside the joint. So A2M is indicated for intra-articular joint injections. That A2M molecule then binds to and deactivates these proteases. And then your bloodstream and your lymph circulation will carry that out of the body to dramatically reduce puffiness, swelling, inflammation, pain. And again, this is cleaning up the inside of the joint, getting it ready for the regenerative phase, the repair phase. On the way there, depending on it, if we on your personalized plan, we may recommend the healing between visits, advanced home therapy tool. This is advanced red light therapy, or otherwise known as photobiomodulation. This has been recognized nationally and even internationally. One of the famous spokespersons for this is Ben Greenfield, biohacker, nutritionist, and best-selling author. A huge fan of Ben Greenfield, and Ben Greenfield is a huge fan of the red light therapy. How does red light therapy work? Well, it's targeted red light therapy. It uses therapeutic wavelengths of the 660 nanometer deep red light and 808 nanometers infrared light to stimulate improved blood flow, improved energy production in the mitochondria. So it upregulates your mitochondria, and then it stimulates healing of the damaged tissues. This helps reduce pain and inflammation at the source and improves long-term recovery for chronic and acute conditions. It also gets you off of any pain meds. This is a phenomenal treatment to get you off as quickly as possible off any over-the-counter or prescription pain medications. Think of this as your non-pharmaceutical pain management while you're going through your recovery process. The next step This is also part of the preparation phase, prepare phase. Step 4 is PRP, or platelet-rich plasma. This is targeted treatment outside the joint. Muscle, pain, inflammation, ligaments and tendons get inflamed. There's muscle weakness. We restore the strength of the muscles, strengthening the elasticity of your ligaments and tendons, as well as inflammation in the nerves. So we've got to address all of those tissues, because very rarely is it just pain from your worn out cartilage. You're also got inflammation in all these tissues, and so many other providers just ignore these parts of the tissue that are so desperate for care and attention. The final phase of the preparation phase before we start the repair phase is prolozone. Prolozone promotes tissue oxygenation for faster healing. So we inject ozone gas into the joint and or the surrounding tissue. Ozone rapidly breaks down into oxygen, and oxygen is critical for cellular tissue and healing repair. Think of it like injecting fresh air into a suffocating room. You know, that breath of fresh air you get. Prolozone reduces inflammation, relieves pain, and sets the stage for regeneration. So with that, the prepare phase is completed. Now that we've fixed the cracks, so to speak, in the foundation, we're ready for the repair phase, which is the Wharton's jelly allograft, aka stem cells. So once the site is cleared, oxygenated, and primed, we inject Wharton's jelly, an ultra-rich biological derived from healthy, ethically donated umbilical cord tissue. Rather than throw the umbilical cord and placental tissue out as medical waste, a pre-screened mother donor qualifies through a very rigorous FDA-cleared screening process. And then the umbilical cord is now a source of young, potent stem cells that are universally donated to anyone, due to the fact that there are no antigens on the cell, so there's no chance that your body will reject them. Over hundreds of thousands of treatments for the past 20 years, and no adverse reported events. They're one of the safest medical treatments in modern history. Safer than over-the-counter ibuprofen, which we know causes so many complications. These cells migrate toward the injury. They release regenerative signals and help your body to rebuild cartilage, tendons, ligament tissue, not just patch it. They're safe, immune neutral, and non-surgical. Comparison, there's a lot of stem cell regenerative clinics out there. Most of them are using your own stem cells from bone marrow. According to the research, by the age 40, you see this graph here. When we're newborn, 1 in 10,000 bone marrow cells will be a stem cell. By the time you're age 40, your bank of stem cells is 95% depleted. They do not renew themselves. Also, your stem cells do not replace themselves, so they are the same age as you. They're getting older, whatever your age is. And the extraction out of your hip bone marrow is extremely painful. So these are all comparison and disadvantages to using not minimally invasive Wharton's jelly umbilical-derived stem cells, which are young, potent, plentiful, and very minimal in terms of invasiveness. How do these medicinal signaling cells know where to go for tissue repair? When we inject them into your joint, they're actually attracted to the inflamed, damaged tissues. Our tissues release SOS signals when they're in deterioration and in pain, and that SOS signal attracts the stem cells, which then release highly specific to that type of tissue growth factors where they're needed. These growth factors land on your cell's receptor sites and activate the regeneration, rebuilding, repair processes, the mechanisms inside the cell. This signaling, your body does not heal without it. So we're just amping up this natural signal that takes place normally in the presence of stem cells. Stem cells are the only cells that can create and produce these tissue growth factors. All visits, so all of our visits is very important to stimulate lymphatic drainage, because that's what pulls the inflammation out of the body and clears it. Most people don't even know what their lymph system does. It's your body's sewage system. It's responsible for flushing out inflammation, toxins, and metabolic waste. Here's the thing. Unlike your heart, the lymphatic system has no pump. So when it's stagnant, healing stalls. Flowpresso, this is a picture of our Flowpresso unit, is like a spa grade reboot for your detox system. Think of it like a rhythmic massage suit that compresses, detoxifies, and calms the nervous system all at once. It combines compression, infrared, and even emotional de-stress in one relaxing 30-minute session. This is usually following the injection procedures. It flushes inflammation, boosts circulation, and clears up space for your body to heal. Think of like this. Healing without lymphatic drainage is like renovating your home and never taking out the trash. It just builds up and builds up. So Flowpresso is taking the trash out. Makes you feel lighter, calmer, and clearer. Okay, phase 2 repair is where we start introducing stabilization and strengthening with physical therapy prescription. We don't do the physical therapy here. We give you a prescription. You got to choose somewhere close to home, or we'll help you find a place that's close to home. Begins approximately 4 weeks after your GPF method. Physical therapy is another step in the neuromuscular re-education process to restore, stabilize normal, healthy joint function for the long term, getting you back to the activities and just living life without pain. You'll receive training, support, and guidance in power nutrition for healing, energy, and anti-inflammation, to look your best, to feel your best, and to perform your best. Our average patient loses 25 pounds following our nutrition protocol. This is a map here, a roadmap that you receive a nice infographic poster as part of your program when you are accepted into care. And we go over this in detail with you. And it phenomenally helps the healing process. What's our success rate? Well, again, our 87.5% success rate after 1 year. Your regenerative treatments will continue regenerating and rebuilding tissue for up to 12 months. After that, that's your final outcome. That's what your result is after about a year. Your pain gradually getting better and better by the day, by the week, by the month, until you are on average about 12 weeks into it. You're turning the corner, and the rest of it's gravy at that point. And obviously every person is a little different, and results may vary, but that's our average, what we've seen over 10,000 treatments. This is some before and after x-rays of some knee joints. We can see that the before on this area here, and then the after of 1 year. Again, we have another weight-bearing x-ray demonstrates increased bone separation from cartilage regeneration. You can see right here, there's nearly touching bone on bone, and now this patient has enough cartilage to last them many years to come with pain-free function. Some of what our patients are saying, you can read dozens and dozens of reviews on our Google listing. We have a YouTube channel, Pinnacle Integrative Health, and you can go to our YouTube channel. We have dozens and dozens of case studies and reviews with a nearly perfect 5 out of 5, 4.9 stars out of 5 stars. So I encourage you to go to look us up on the Pinnacle. Here's our Google listing here. Got more reviews than that, but highly encourage you to read through, find some cases that you can identify with. One is exceptional here. Mike Connolly, he's 56. He says, I had bulging discs and stenosis in my back that was painful and made life hard to live with. After MRI and standard doctor visits, I was told I needed surgery. 6 months on my back was not an option, so I called Pinnacle, received the option to get stem cells. Between the cells and the entire health program, I've lost 35 pounds. I have no pain. I can do anything, including skiing, mountain bike, swimming, and golf. I did the treatment April 1st and was able to do most everything in 6 weeks. This is an amazing treatment that I would recommend to anyone experiencing pain. Thank you, Pinnacle. So that's just one example of many of the case studies that we've treated with phenomenal outcomes. Obviously, you have to get qualified for this treatment. We have to make sure that you're within the window of opportunity where it will work as intended. How to get to us? So parking first. You can pre-book your parking by going to www.parking.com. So basically parking.com, you see that website here, and you search for Westlake Tower. And it's going to give you the 457 Olive Way. So 457 Olive Way, that's the correct entrance address. It's about $7 per hour. We recommend booking 2 hours to give yourself plenty of time. So that's going to be $15. You can book online, and that's optional. You don't have to, or you can pay when you enter the garage. So after parking, you're going to take the elevator up to the street level, up to 5th Avenue and Olive Way. Okay, so that's that's the parking, the best parking, the cheapest parking that you're going to find in our area. Now, once you get up to the street level, there's some landmarks to look for. Number one, you want to look for the monorail over your head. Look at the monorail up above you and cross 5th Avenue towards the Cherry Street Coffee House sign. And that's this middle picture here. That's what it looks like, Cherry Street Coffee. And then you're going to see right after that, you're going to see the medical dental building entrance. And then you go right up to, take the elevator right up to the 8th floor. And we are in suite 803. So that's, again, just to recap, parking.com, search for Westlake Tower on their search bar. It'll give you the 457 Olive Way parking entrance. So 457 Olive Way. And then you can pre-book or prepay for your parking. Okay, and then so when you arrive at the office, what happens next? Well, we do your consultation and exam. To prepare and be ready for it, we ask you fill out your online intake forms. The link is in your appointment confirmation email from Pinnacle Integrative Health. So look in your spam folder if you don't see it. Search all inboxes for Pinnacle Integrative Health, and it should pull up all the emails that we've sent you in preparation for your visit. Our policy is that you need to have your spouse or support person, your partner, whatever, with you. If you're a candidate at this visit, we find that those who have their spouse or their partner with them achieve a 20% better overall outcomes because you've got the whole team is on board. You've got your support person, and you know that you've got your the whole team involved. That's what it takes. At your visit, we're going to do a comprehensive full evaluation orthopedic exam to determine if you're a candidate. And then if you are, we'll do our recommended customized, personalized program. There's no pressure, there's no gimmicks, just clarity. Number of visits can vary from a minimum of 4 visits, office visits, usually once a week, or sometimes we have patients coming from Canada and they come down every few weeks. So it's a flexible series of the prepare and repair phases. And sometimes in severe, very advanced degenerative cases, sometimes we'll need to do more visits than that. But again, everybody's a little different. We customize everything to you. So if you're tired of symptom chasing and you're ready for a better way, this is your moment. This is not a wait until it's worse mentality or mindset. This is get upstream from the problem and treat it preventatively so that you don't run out of options, because even this is the treatment that one would do prior, most advanced, next to getting surgery. So this is high level care. We want to make sure we have the right candidate. And if you're not, we'll let you know. We'll refer you to surgery. So we hope that we can help you. Don't wait. Don't kick the can down the road. Discover if you're a candidate. And then let's build a plan to get you pain-free, energized, and back to the life you love. And we can't wait to meet you and support your journey back to full function. I do want to just kind of go through our team really quick here. When you come in, you'll be seeing Tam at the front desk. That he's on the right, and then you'll be meeting with either myself or Oliver before your exam, and then either Maria or Jared, our orthopedic specialists, will do the exam and make recommendations if you are a candidate. So that's the team. We look forward to meeting you. Can't wait to see how we can be of service. Have a wonderful day or evening or morning, and we'll see you here at the clinic.